Well, thank you so much. And I'd like to thank Glock for putting together this conference and of course the sponsors. So please do stop by and see them. I also wanted to point out my contact information. Here's my email address. So if you have any questions about anything we've talked about, feel free to reach out. I'm always happy to respond. So oquin.4. What we're going to do this hour is sort of drill down on some of the stuff we talked about in the occupational health and safety section, focusing on zoonotic diseases and zoonotic disease prevention. I'm hoping just to thank you guys for hanging in here through the end of the day. Like if you could let me know what your role is in the shelter, you can just type it in the chat, whether you're in medical as a veterinarian or technician or animal care staff or adoptions, administration, behavior. Just let me know real quick so I can get a sense of the depth and breadth of what you guys are doing. Great. Thanks. Seeing a lot of medical staff. Not too surprising, since this is something that runs near and dear to our hearts typically. Oh, great. Animal control officers, volunteers. We've got some variety out here. All right, so most of you know zoonotic diseases are those that can be transmitted from animals to people. And sometimes back in a reverse zoonosis, but for the most part from animals to people. But some of you may be surprised to know how common they are. Over 1,400 human pathogens. So 1,400 diseases known to affect people. And 60% of those are zoonotic. And of those that are emerging, 75% are zoonotic. Thank you guys all for coming. So why do we care about that? Our work is largely to do with people, right? We care for a lot of animals, but those animals are attached to people, either being surrendered or bringing them in or caring for them or hopefully taking them home. So we have a lot of human animal contact with the public, with community volunteers who come and exercise and socialize and do so much great work with our animals. Our staff who come in every day to care for those animals. So millions of animals in shelters every year and millions of hours of care provided to them by people. We also invite people to come and hang out. We have mobile units that go out into the community for education and outreach or adoption events. So lots of offsite adoption programs that we take animals to. Foster care programs. So we're not limited by the doors of our facility. We have programs sometimes with large numbers of animals in foster care, in homes, in the community. So whatever those animals might be carrying goes with them into the community. And this can serve as a source to amplify disease in the community. I am reminded of kittens that were being fostered that had ringworm as yet undiagnosed until they were the hit at the 4-H meeting that was held at their home. So lots of exposures from that single event. We have some behavior support programs as well and enrichment activities that involve special needs students, prisons, or at-risk youth. So animals staying long-term in some of these facilities. So as you can imagine, there's lots and lots of opportunities there for zoonotic disease transmission. Fortunately, we don't see large outbreaks, although there certainly is the opportunity for that to occur. The cases do pop up all over the place. The compendium of measures to prevent diseases associated with animals in public settings is a really great resource put out by the National Association of State Public Health Veterinarians. And while they don't mention shelters specifically in this document, we are pretty much the definition of a public setting. Unlike livestock farms and other places where access is limited and animals are purchased from a healthy herd source and quarantined before intake, all of these disease prevention measures in place they're not available and they don't work for us in shelters. So we have to rely on other methods. So these public health setting guidelines are really, really relevant. And we're seeing, they are seeing across the species, whenever we have animals and people mingling, an elevated risk in certain conditions, which as you look through this list, stress causes an increase in the shedding of our infectious agents. And these animals are stressed by transportation, confinement, crowding, handling, unfamiliar surroundings. All of those things are stressful. All of those things existing in the shelter. Commingling of animals, and just the fact that young animals tend to be preferred by the people, and those same young animals are at highest risk for getting disease and for spreading it, since they certainly are the belle of the ball, if you will. So this is a great resource. I just wanted to make sure that that you guys were aware existed. So what can we do to focus to prevent zoonotic diseases? And that's really what the focus of this is going to be, is not necessarily a whole lot about specific diseases. I covered last year several diseases in a lot of detail. This is sort of a higher level. What can we do to prevent zoonotic disease transmission? And I'll have several examples as we go through here. But one of the more important things is to know the common pathogens that we might have to deal with, that these animals might come in with or develop and then spread to people, and know the routes that those diseases are transmitted. We can design prevention measures that will prevent a host of diseases that have a very similar transmission route. So we don't have to focus on knowing every single one. We can use some general prevention measures that can be quite effective at preventing a lot of diseases. And that's what we do. And you also want to recognize what activities are higher risk, right? So dental examination versus a dental cleaning. So if you're looking and doing an exam on a mouth, even if there's a lot of dental tartar, it's not the highest risk, especially not compared to a dental cleaning where you're putting, ultrasonic, very high pressure water and creating a spray of what most likely carries quite a bit of bacteria from the mouth. And some of those could be infectious for people. So kind of similar, we're both looking at a dirty, nasty mouth, but the activity changes the risk for what's being done. And then that changes the prevention that we need, especially with respect to PPE. So we need to select that personal protective equipment based on the routes of transmission and the likelihood of exposure, putting that all together in the risk assessment, right? If you were at the morning session, we talked about doing risk assessments. So I want to talk a little bit about the routes of transmission. And for those of you vet techs and vets, this is going to be a review, so feel free to chime in if you have anything to add. Direct transmission. This occurs when we have direct contact with the animal or their tissues or their fluids. And then the pathogens, the microorganisms that they're carrying can be transferred to us, right? So ringworm is a great example for this, and we'll talk about that a little bit later. Leptospirosis in the urine, multi-drug resistant pathogens from the skin, all of those are going to be direct contact transmissions. And then we have fomite or indirect transmission, right? So when inanimate objects are contaminated or the environment is contaminated and we come in contact with that contaminated environment, then we can pick that up. And this tends to be more of an issue with pathogens that can survive for long periods of time, like parvovirus, panleukopenia, feline calicivirus. These pathogens can survive in for a long time in the environment outside of the animal that they were living on, and then they can very easily be spread around and left behind and then picked up by us as we're traveling through or managing those items. All right. So we have aerosol transmission as well. So there's a couple things that can happen here. This basically is the pathogen is in the air. Small pathogens can be aerosolized, which means that they can, in very fine particles, float and stay in the air for a longer period of time and travel farther distances. More commonly, though, we see droplets. So these are a little bit larger particles that may travel a few feet before they settle on something and leave the pathogen behind, usually a little bubble of something wet that helps it survive. So these airborne transmissions tend to be produced when an animal is sneezing or coughing, or if it's on a surface and we spray that with a high pressure water hose, we can create those droplets ourselves and then spread them around a room because we hit, say, a pile of diarrhea with a very high pressure hose, and we created this shower, if you will, and spreading everything around. So we see this transmission with canine distemper virus, influenza, Bordetella, again, mostly respiratory pathogens, but again, some fecal pathogens, if we help it into the air, can spread that way as well. And then we have oral transmission. So this is when we hopefully accidentally eat the pathogen. And that occurs when we have environmental contamination with feces, urine, saliva that's carrying that bacteria, that virus, or that parasite. And that gets on food or water, and we eat or drink it, or it gets on our hands. And then in the process of fixing food or eating, we contaminate that food before we eat it, right? So this, lots of things can be transmitted this way as well. Again, those durable pathogens hang around a lot longer, but Campylobacter, Salmonella, other common foodborne diseases can be transmitted this way. And you see leptospirosis on this list as well. It's important to note that pathogens can be transmitted more than one way. So, and it's going to just depend on that pathogen, which is the one that's most common. And then we have vector-borne diseases, right? So these are the pathogens that live inside of another animal, typically insect or an arachnid. Rodents are also good vectors of disease, and they live inside that and then travel around. So some things are transmitted, not a zoonotic disease, but heartworm disease by a mosquito bite. We have a lot of tick-borne diseases that are zoonotic. So Lyme disease, Rocky Mountain spotted fever, the plague, things like that, transmitted by those vectors. Cat scratch disease is transmitted from cat to cat by fleas, and then from cats to people by cat scratches predominantly. So those vector-borne diseases, quite a few of those around, and really underscores the importance of shelters in managing those pest populations so that they're not spreading disease among the animals or to people. If you were with me earlier today, then you saw this amazing drawing by Dr. Kate Hurley. I love this little dog who's oozing and secreting and leaving piles everywhere. And I added in around it sort of a non-comprehensive list of pathogens that are spread through various things that this animal leaves behind, whether that's saliva or urine or feces. So this kind of helps start think about pathogen transmission routes and what diseases are transmitted by what routes, and how can we then turn that information into prevention. So let's talk about our enterics. These are gastrointestinal pathogens. So they live in the gastrointestinal system and pass out through feces primarily, but also sometimes through vomiting. And we get exposed to these through direct contact with the animal who may be contaminated, or their excretions, their feces usually, or indirect contact with the contaminated environment. And in shelters, this is pretty much every day in the shelter, right? We're cleaning runs and cleaning cages, cleaning up messes on floors. This is what we spend a lot of time doing. And so these environments are a great source for indirect contact. Even the play yards and exercise yards outside, if that waste isn't picked up right away, they, and even if it is, there's contamination, just less of it, right? And then that fecal oral transmission route is pretty common, where we accidentally ingest the pathogens that come to us through many routes, right? I don't think any of us actually eat poop for fun. So it's really a contamination that we're unaware of food or water, or just from our hands directly through different facial contact. We'll talk about what some of those are in just a little bit. So what are some of the things we're worried about? Intestinal parasites. We know from several studies, and even more than are listed here, that shelter animals have a higher parasite burden. So they're more likely to have an intestinal parasite, and they're more likely to have more than one type of intestinal parasite at the same time. So we know that our yards are probably pretty contaminated with those, not just because we have a whole lot of animals, but because we have more animals that are infected. So larval migrans becomes a concern. What that is when the parasite eggs, and this is typically roundworms and hookworms, when those parasite eggs are deposited in the feces and they stay in the environment for a period of time, then they embryonate and they become infectious at that point. And that's when the animals usually come along, pick them up on their coat, groom themselves, or they eat some grass, or in other ways accidentally ingest them and become infected. People can accidentally ingest those as well. And for the most part, they don't cause a problem. They might wander around in there for a little while, and they don't survive that long because we're not their intended hosts. And they get lost and then they die. But sometimes when they get lost, they go places we don't want them. Or sometimes when there's a whole lot of them, we'll see more issues as they migrate into the liver or into the lungs. And for roundworms, it becomes a big problem when they migrate into the eye. And it's not that common, but when it happens, it very, very frequently leads to blindness in that eye. So we do have a lot of people, especially children, who become blind in one eye due to ocular larval migrans. The CDC reports that between 5 to 15% of us are positive, seropositive, which means we've been infected with Toxocara, the roundworm, at some point in our lives. So that's probably pretty surprising to a lot of people that we would have that high of a rate. In developing areas of the world, it's much, much higher. This gross looking foot, I don't know if you can see this sort of serpentine lesion, that's from a hookworm larva. So the egg embryonated, and hookworms are unique because they can actually penetrate the skin. And so that's what happens. People walking around barefoot in infected areas will sometimes pick up a hookworm, and it'll burrow under the skin for a little while. Itches like absolute madness, but they don't survive very long. This is self-limiting, and they tend to die off very quickly, which is good for us. But it's still not pleasant to have. Why is this important? People don't particularly like to get parasites. And there are lawsuits that have been filed when, especially children are infected, especially if they become blind. And there was a pet store that was asked to pay almost $500,000 to the family of a child who lost its eyesight when a puppy that they purchased there passed on an egg to the child, and that child lost sight in one eye. It wasn't a shelter, but it could easily be. And so it's really important that we take preventive measures through parasite prevention and those types of things. Prophylactic treatment is strongly recommended in this situation because of the zoonotic risks of these diseases. And that means that we treat whether or not we find the parasite or not, because the consequences are pretty high. And honestly, most of them are infected at some point, if not at that particular point. So what else can we do? Well, until these guys can take care of themselves, we need to pick it up. We have to pick up after them. So critical. It does take a couple weeks for most of these parasites to embryonate and become infectious. So we have this sweet window of opportunity that if we can clean it all up and dispose of it, it's gone. But once it sits there for a while and the feces is washed away, we can't find those eggs anymore and they become infectious. And then we can have very highly contaminated yards and play areas. I've seen a lot of shelters that animals come in, test negative for intestinal parasites, and then a couple of weeks later are testing positive for whipworms, usually 3 or more weeks later, that they've picked up actually there after arrival. So just something to keep in mind. Other enterics, other GI bugs, Giardia and crypto have question marks. People can get those, animals can get them, but it's not very common that we share the same ones. It is possible, but it's not that common. We tend to have our own flavors, if you will. Campylobacter, Salmonella, we can share those pretty freely and do. Toxoplasma is another parasite carried by cats. So these also, as I mentioned, lots of things pass in the stool. Poop is gross. You guys all know that. Some of the things can infect us. And so the prevention measures that we take to prevent that fecal oral transmission route and to prevent direct and indirect contact with fecal-borne pathogens is going to be effective for pretty much all of them. So that's great. We don't have to know everything about every one of these diseases in order to protect ourselves from them. So that's a really great thing. What are you going to do? Wear gloves and wash your hands when you take your gloves off. When you're cleaning cages, wear gloves. When we'll talk about some more times to do hand washing and things in just a second, but back to cleaning your cages, one of the most important things you can do is remove all organic matter first. That's all the food, any urine, any feces, even the smear, right? If you've scooped it up and there's a smear there, that needs to come up. That's part of the cleaning process before you start to put a disinfectant down. First of all, that organic matter can inactivate your disinfectant and protect pathogens from the disinfectant. But also, especially if you're using high pressure water hoses, you can just shower that out into the air. So lots of good reasons to get that all removed and cleaned up. And apply your cleaner or your disinfectant and make sure that you're wearing appropriate PPE for the activity that you're doing. You might need different PPE if you're just spraying out a cage versus a run with a hose, right? So your PPE needs to match what you're doing and the tools that you're using. In general, you want to cover your skin, exposed skin, and possibly your mucous membranes. You may want to wear goggles or a mask, depending on where you are and what potential pathogens you think you're dealing with. Right. I already mentioned that some of these pathogens are very, very persistent in the environment and on the animal. Salmonella can live for quite some time and others. And you can pick things up, especially parasites from outdoor walk areas and play areas. You can pick them up, the animals can pick them up and bring them back in. So wear gloves. Consider the animals contaminated. Consider their hair coats contaminated, especially if you're dealing with dogs that are like poop paddlers in their runs. I mean, we know those guys are contaminated, but even those that are less messy with their waste can also be. Maybe they went outside in the yard and they were rolling around and you can't see it, but there's contamination there. So wear gloves, wash your hands, no kissing, no kissing. I know that's a terrible, mean thing to say, but this is not your pet at home. This animal carries a higher risk of transmission of disease just by being in the shelter, just by being around so many other animals. All right, I'm gonna say fecal oral transmission again, because it's gross and I really want you guys to not have to deal with it, right? When are you gonna wash your hands? After you remove your gloves. A lot of people forget that, but it's really important. Your gloves may have had holes. Your hands might not have been clean when you put them on. You may have contaminated your skin when you were taking the gloves off. It's a whole lot of things, but wash your hands after you remove your gloves. So important. after you handle an animal or its environment or its food or pet treats. Remember that pet food is not sterile. It's not, it's kind of, I kind of picture it as raw chicken. And anything that I would, if I would clean a counter off after I had raw chicken on it, I would clean a counter off after I had pet food on it. Then you want to use that same level of hygiene in between, because they can be contaminated with salmonella and other pathogens. Wash your hands before you eat so that you don't contaminate your food and your drink, or before you prepare food. And before you have any facial contact, whether that's fixing your makeup or your contacts or smoking, anytime your hands are going to touch your face, which mine do a lot because I'm a fidgeter, you want to wash your hands. Okay, here's a nice little chart that talks about how to wash your hands. One of the questions I get a lot, hand washing versus alcohol gel. Both have cons and both have drawbacks, right? So some of the cons of hand washing is it's inconvenient and it takes a while, and your hands get dry. You may not have water and soap where you are. There's lots of drawbacks there, and for those reasons, alcohol gel is really convenient, and we really should have it in several places around the facility. It's faster, but it doesn't work all the time. It only works when your hands are clean. So if your hands are visibly soiled, if you rub them and you get that kind of grunge, the alcohol gel is not going to touch any pathogens that are on your hands. They have to be clean in order for that to work. So if they're dirty, you need to wash them by hand. Also, it's not effective against all the pathogens. It is pretty good against bacteria, and it's pretty good against some viruses, like rabies virus, maybe, but not very good against other viruses like parvo or calicivirus, which are really difficult to kill. And it's not effective against ringworm spores either. So it does us no good to use alcohol gel if those are the pathogens that we believe we're dealing with. So maybe you're leaving an ISO area. Alcohol gel is not going to do it for you. Basically, you're just going to be depositing these pathogens on the alcohol gel dispenser, and the next person that uses it is going to get exposed. The alcohol that they got isn't going to get rid of those pathogens, and then they're going to carry it and spread it around. Also, you need to make sure that you do that correctly. So you need to use the same motions that you use for hand washing, and it needs to be wet for about 15 to 20 seconds to get a good maximum kill from that alcohol gel. So it's a great product. I'm not trying to bash it. It's just that it's important to know when it works and when you need to go wash your hands. Now, the soap isn't going to kill those pathogens either, but the benefit is that they're dislodged from your hands and they're rinsed away with the running water. And that's just as good as killing them, because they're no longer where you're going to be having to deal with them. All right, I want to show this video. Hopefully this will play. This is a really great example of how to wash your hands appropriately. So they put gloves on because they're going to use black ink to show you the technique. And I know all of us roll our eyes and we're like, we know how to wash our hands, but most of us don't do it correctly, at least not all the time. We don't take the time. So here, rubbing the hands together, everybody does this part pretty well. And you saw that it only got the front part. Now we're rubbing between the fingers, still only the front. So now you flip it over and rub the backs, and then switch hands and rub the backs. And we're getting a little bit better here, but she'll show you in just a second. There's still quite a bit, and these are the areas most likely to be contaminated that we've missed. And so that's why we do this motion here. And we're just kind of rubbing the fingers, and see how that got all the tips, but not the thumbs. So we need to address our thumbs separately. And I do this with my students with glow germ to show. This is a good way to get under your nails, to do that little twisting motion. And then now we just have the wrists to take care of. So imagine if we could actually see it when we were washing our hands, what a better job we would do. And now when you rinse, you want to rinse down and let the water run down your hand to run off into the sink. All right. Oh, we don't need to see it again. Okay, I mentioned dentals and looking in nasty, dirty mouths, right? So we've got kind of a before and after shot up here of our dental, and all too commonly we see people doing dentals like this gentleman with no protection, no eye protection, even though tartar could go flying, no eye protection or respiratory protection, even though we're putting a lot of bacteria into the air as we're cleaning that tartar out of the mouth. So over here is exactly what we need, not just gloves, but also face protection. So PPE needs to match the pathogen, but also the route of transmission, right? And the risk of transmission based on the activity of what we're doing. Animal bites, definitely an occupational safety issue. So this is physical trauma, penetrating, crushing, and tearing, but also introduces a great deal of bacteria. Cat bites much more likely to become infected and more likely to become severely infected than dog bites, but dog bites do a pretty good job of it as well, especially if we're not getting first aid to it, or if the puncture is deep and closes over pretty quickly, creating the perfect storm for an abscess. For this occupational hazard, those of us working with animals are at much higher risk. So they did a survey of vets in Minnesota and Wisconsin and found that almost all of us honestly had been bitten at least once by dogs and by cats. I don't know, I haven't seen a study done in shelter workers, but I bet it's the same or even higher, honestly, because of just the stress that a lot of these animals are under and the sheer number of animals that we're bringing in. So how do we prevent this? Don't work alone. Really should not be working alone. Even if an animal doesn't seem fractious, you should always have someone around just in case something goes bad, and have a plan. What are you gonna do if this dog charges at you? What are you gonna do if this dog that you thought was in the run wasn't in the run? And I walked in a ward once with a little dog to put away in a cage, and there was a dog that I guess the cage door didn't latch, but we didn't know. And this was not a friendly dog. This was a very aggressive, human aggressive dog. And I was, walking down the aisle, and he came around the corner and squared off, and I saw his eyes, and I was, I'll never forget how I felt when I saw that. And there was nobody around. There was nothing I could do except for jump in the run with another dog, which is exactly what I did. And then I shut the door right before he hit that door with a full body slam. So and then I yelled a whole lot until somebody came to help. We didn't have cell phones back then, if I'm dating myself, I guess, but that was that. So have a plan. What are you going to do if something like that happens? Bites carry other zoonotic diseases besides bacterial infections, rabies. So this was just a year and a half ago in Michigan, a pet cat that was diagnosed with rabies. And I know you guys see a lot in Michigan, and some states see more than others. Fortunately, we don't see as much in Ohio, but we certainly do get quite a bit of wildlife. And I'll tell you that rabid bats make great cat toys. So when I worked for the Ohio Department of Health, that was one of the most common exposure routes. And most of those cats, watch him, they're going to do it again in slow motion. Look at it. But most of the rabid bats that we got that were caught by cats were house cats that never went outside. Isn't that amazing? So I found this video on YouTube, and all of the comments, even from the owner, were about like how cool it was and making nom nom noises. And not once did that person or anybody mention the risk of rabies. And I don't believe that bat was tested, because I think there was another video actually eating the bat. So you say that will never happen in shelters, but this does. This happened in a shelter. And if this is your shelter, my apologies. But it is really cute. I get it. But as a public health veterinarian, I'm horrified, especially one who's worked on rabies surveillance and control in the United States as well as in Africa. This is potentially a high risk situation when we can transfer raccoon roundworm and other pathogens as well. But direct contact like that, and there's so many opportunities. Animals that are free roaming, we don't know how often it happens, but we know it happens a lot. And then to allow that to happen in our facilities as well. This is something that we need to take measures to prevent from happening. And similarly, between animals, right? Because we never know when one of those might be rabid. So this puppy, just last year, about a year ago, developed rabies while housed at an animal shelter and exposed a great deal of other animals while it was potentially contagious. So we need to always be thinking that even when they look normal, there might be a zoonotic disease. Now, does that mean we don't take any risks? No, of course we're going to, but we need to be aware of it. We need to minimize unnecessary risks. Socialization and things like that are really essential, but maybe keep track of who's hanging out with who so that you know, and maybe limit so that it's not like this animal plays with everybody else in the shelter and different people, different animals every day, those kinds of things. Do your best to try and minimize that because it can spread animal to animal diseases as well as zoonotic diseases. So cats are the most common domestic animal that is diagnosed with rabies, even though we usually talk about dogs. Cats are actually more likely to get rabies and more likely to expose numerous people. On average, 7 people are exposed for every rabid cat that's diagnosed. And most of those are animal care staff, veterinarians, veterinary technicians, and those providing direct care. So we need to remember the virus is in the saliva, in the tears, in the CNS fluid, and in the nervous tissue, like the spinal cord and the brain. So we need to know what materials are contagious, are potentially infectious, and we need to know how that's spread, right? Spread mostly through a bite. So actually injecting that virus-laden saliva through the skin, or contact with a wound, an open wound, or with the mucous membranes where the virus could be absorbed through the mucous membranes. So that's the primary routes. It does spread through ingestion. When we see animals scavenging on rabid animals that had died, they will potentially get rabies. So that's another option, but not very often do we see that. So what are the risks for us in the shelter? Unrecognized rabid animal, right? They can be contagious for a little while before they start to show clinical signs. Or you may have a rabid animal that is clinical and maybe it's not recognized. So in North Dakota, there was a dog that developed signs of rabies after adoption. And as they were doing their investigation, they found that it had come in with another dog, and that dog had been euthanized a few days after arrival for aggression. But nobody thought about rabies. Now, we don't know if it was rabies or not, but it might have been. His severe aggression might have been rabies and not just a behavioral issue, but we don't know. So there are those that are clinical that are euthanized that we don't even know that that's what they had. Fortunately, it's not wildly common, and that's a good thing, but it's just something we need to keep on our radar because this is a fatal disease. This is not one that we want to play with. It's not just an inconvenience. So some of the signs that we typically see are quite varied depending on what part of the brain is involved. Behavior changes are predominant, and we tend to see those first and always. Aggression is sometimes present, sometimes just depression, and a lack of awareness of their surroundings. Any variety of neurologic signs, from twitches to staggering gaits to paralysis or seizures to just like a comatose state. Another common sign I think is important to mention, because we see paralysis of the throat muscles, is that their voice is altered. So often people describe a very strange sounding bark or a very strange meow when they do vocalize. So that's something that should always raise your level of suspicion. So what else is a risk in a shelter? We have a lot of staff who are decapitating animals for rabies testing or receiving, euthanizing, and potentially sending for testing sick or injured wildlife. So there's lots of opportunities for risky exposures. As a result of that, it is strongly recommended that all of the animal staff receive rabies vaccination. Receiving that series of vaccination is really important for having immunity on board already, because as I mentioned, you may not recognize that there's a case. You may not recognize every exposure that occurs, so it can provide you protection for that. Also, if you are exposed, it's going to start to work very quickly compared to having to receive a series of vaccines to teach your immune system how to identify rabies and fight it off. That takes a little bit of time. It's still an incredibly effective and worthwhile treatment, and it's life-saving, and it should be begun very soon after the exposure. But having that vaccine on board already is much more effective. And then you can just get boosters to kind of raise your antibody levels. So if you can't afford to have everybody get this, and that's the case for many shelters, you need to do some triage and see who's at highest risk based on the tasks that they're providing. So those that are interacting with stray animals in the field who might get exposed and then not actually be able to bring that animal in, including wildlife, dogs, cats, those guys should be vaccinated because the animals they interact with may be lost to follow-up. Those that are performing euthanasia, again, that animal is going to get disposed of. It's not going to be available to develop signs to let us know that it has rabies. So we need, those people should be vaccinated. Those that are performing decapitations, right? Not only are those the most likely animals to be positive, but also they're using sharp instruments that could cut themselves, expose themselves in other ways. And those that are caring for bite quarantine animals also. So if you have to prioritize certain people to get that vaccine. What happens when you get bitten? Immediate first aid, immediate wash with soap, disinfectant under running water for at least 5 minutes. I tell people to aim for 10 and I hope they get at least 5. But that active flushing with water and the use of any kind of a soap or disinfectant will reduce virus that's present, and that can reduce the chances of getting rabies as well as other bacterial infections. All dog bites, all cat bites, in most states, all mammal bites have to be reported to the local public health authorities, and that's required. It doesn't matter whether it was intentional. It doesn't matter whether it was a play bite. It doesn't matter whether he already bit somebody and he's already on quarantine. They all have to be reported so that public health can provide appropriate follow-up and do a risk assessment for that. So make sure that that happens. And one thing that I found really interesting, and it's probably going to vary by state, but even if you send an animal sample in for testing, that's not the same as reporting the bite, because they often go to completely different parts of the state. So if you get bitten and then you send the head off for testing, sending the head off for testing is not always the same as reporting the bite. You need to do both. Okay. And always, always, always ask on intake of an animal, especially if it's an owner requested euthanasia or if it's sick or injured and likely to have euthanasia, but should ask on every intake, has the animal bitten anyone in the last 10 days? So we need to identify that, because those animals need to be quarantined or tested. One or the other of those needs to happen if someone was potentially exposed in the 10 days prior. So really important to ask that. And I ask that even for surgeries, because we don't want to put an animal under anesthesia when it should actually be on quarantine. And what if it died under anesthesia? I mean, we hope that never happens, but sometimes it does. And we would lose that animal for follow-up because we wouldn't have known that was even an issue. I had a question on the first hour about how do you clean up your environment after you decapitate, or after you have a rabies suspect, maybe who's slinging saliva everywhere. And the good news for us is that rabies virus is really, really easy to kill. It doesn't live very long outside of the animal host. When it's dry, it's dead. Sunlight kills it, and all of the common soaps and disinfectants will kill it. So you really just want to cover your skin, protect yourself, and then just your normal disinfection of all items that were in contact will be more than adequate to take care of that. So that's some good news. And if it's outside, as soon as it's dry and the sun comes out, it's going to be dead too. Wimpy virus. All right, so let's move on to some dermatologic. This makes me itch just looking at it. On the top right, we have Calathea, which is often called walking lice. Lice are specific species, but hungry lice will sometimes bite other people, and Calathea will do that. It's self-limiting. They don't hang out or live on us, but we may get a bite or two. Sarcoptic mange, same thing on the bottom. That's pretty unusual for us. They don't live and breed in us, but they will bite us if they're hungry and burrow under our skin and then die and cause a very itchy inflammatory reaction. Ringworm here on the left, though, is very happy in our skin and will make a whole lot of spores, and we will be highly contagious to other animals and to people. So here's a cat and a human with matching skin lesions. On the person, you can see that target lesion that everybody talks about, and I can tell you that it doesn't always look like that. Sometimes it's just a raised red plaque. And in animals, it's highly variable. Sometimes we get that target lesion, sometimes we just get scaling and hair thinning. And sometimes we get some very odd, interesting looking lesions. I wanted to share this case. So this girl's ringworm was body wide, and her entire torso and legs were just as covered as her neck and upper chest. And this was the case for all 6 of the siblings in this household. None of them were immunocompromised. So this family in Cincinnati, Ohio, picked up a kitten off the street. Fortunately, they didn't take it to the shelter and they brought it home. They didn't recognize that it had any issues. And when they started having problems, they saw the doctor on more than one occasion who misdiagnosed this as bacterial infection. So there was no response to that treatment, and it got worse much more quickly. It's actually the veterinarian that diagnosed this when they brought the kitten in for a well check. And while there wasn't a lot of hair loss on the kitten, he saw the kids because they were home from school and was like, let's check for ringworm. So it ended up being ringworm. Everybody did fine. The kitten recovered, the kids all recovered, but they were home from school for quite some time, and they spent a lot of time and money decontaminating their home. So it's not always just an annoying itchy rash that goes away easily. Sometimes it gets to be a bit more than that. So just wanted you to know. And a lot of people are pretty upset about it, even if it is just a single annoying itchy lesion. The ringworm, how do we get that? Direct contact, indirect contact, easily moved around on fomites because it lives for so long outside of off of the animal. And the spores I mentioned are in the hair and the dander, and they get everywhere. Wherever the hair goes, there's going to be spores. And those spores live for months to years and are incredibly difficult to kill. So I don't want to turn this into a ringworm lecture, but I did want to kind of hit the highlights on how are we going to manage this in shelters, right? So the first thing we need to do is identify cases. And that means screening high-risk animals on intake. And that risk varies by shelter. So some shelters may screen every cat that comes in, or every cat and dog that comes in, looking for lesions, doing a Woods lamp, and then maybe doing further diagnostics if they have a lesion or a Woods lamp. Others may not need to screen very many of them. It's really going to depend on where they are and what their intake base looks like. But identifying cases. So here's just a couple of, this is a microscope view of some hairs, and you can see the normal hairs have nice solid lines for their outsides of this like little hairy hair. That's all spores. That's millions and millions of spores right there. Yikes. So treatment we go all out. And we know it's going to take a couple weeks, several weeks actually. We can isolate them in the shelter isolated arrest away from the general population, provided we can effectively prevent transmission from the isolation room to the general population. And that would typically occur through staff and common use items. So as long as we can prevent that, great. If not, we need to look at other options. Maybe they're treated off-site somewhere or in foster care, but remember, this is putting foster homes at risk as well. But because we want to treat this in as short a time as possible, and we want to reduce the infectious nature as quickly as possible, we're going to treat systemically, so oral medication to kill the fungus so that it stops producing spores, but also a topical like lime dip so that we can kill the spores that are there. It's not perfect at it, but it will reduce the spore count quite a bit, whereas other treatment options really don't address that very well. What else can we do? Don't shave them. This is carried around on hairs, and shaving them just creates a whole lot of hair to float around everywhere. There are some exceptions when you may need to do that, but those are pretty rare. If you can avoid it, do not shave them. You also create additional fomites, and you nick the skin, because I don't think any of us have ever shaved an animal down and not nicked the skin. And that creates new infection points for that fungus to get in. And strict PPE. Ideally, the places that do the best job of preventing transmission within the shelter use separate staff entirely. So if that's a possibility, that's incredibly useful to use completely separate staff. So those of you who've done lime dips can smell this right now just from seeing this kitty get her dip. Thanks to Dr. Newberry for these photos. So I don't know why they call it a dip, because it's really more of a soak, or a soak and saturate. But you can see here, excellent PPE, the skin's covered. We've got a hair net because that hair is going to go up in the air and then land on the top of your head. And we've got booties on, so we're protecting our clothes and our shoes and our skin and our hair from getting spores. And well, kittens are cute, right? So no kissing. Remember I said that, no kissing. You don't want to get enterics, and you don't want to get ringworm lesion right on your face, because you can't cover that. You're gonna have to stay home from work. What do we need to do? Decontaminate everything. Discard what we can't disinfect. Debulk and declutter the things you don't need. A laundry dryer is your friend. Dry high heat, and in most dryers can reach over 110 degrees, and that can kill the spores. So that is a fantastic way to do that if it can survive the dryer. Also, commercial dishwashers, not usually residential, but commercial dishwashers can also reach really high temperatures, which is effective at killing spores. So that can be nice for toys and Kongs and dishes and things like that. Don't sweep with a broom. So when you broom up that, it just throws the hair in the air. Same with a vacuum cleaner, unless it has a really good HEPA filter. It'll just blow a volcano of spores up into the air for you. If you just have like a wet dry vac or something like that, it's not gonna help you at all. Swiffers are wonderful because they electrostatically attract and grab the hair and the spores, or a damp mop or something like that. So clean all of the surfaces at least 3 times, including the floors, your transport vehicles, carriers, everything that was potentially contaminated, and clean it again, and then clean it again. We're mechanically removing those spores because it's so hard to kill them. And that's really the most effective use of your time. The disinfectant we put on to catch what we can that's left. And there's several options available that are pretty effective as it can be anyway. There's so much great information out there about ringworm. I just wanted to hit kind of the highlight general principles of how we're doing prevention. Right? So we mentioned in the beginning all of these people. We need to protect them all, right? We need to protect our staff, and that's going to largely be done through ongoing staff training. We're going to teach them about zoonotic diseases and how to prevent them, how to recognize them. We're going to teach them about appropriate PPE and make sure they have it and they know how to use it, make sure they are using it. We teach them about animal behavior, reading body language, and what methods they can use to prevent bites, right? We want to provide rabies vaccines, ideally to everybody. We want to have, and this is never popular, but this is a soapbox that I often stand on, no animals in designated areas where food is prepared and consumed. This is not where you should be fostering animals in your shelter. At your home, it's completely different risk landscape. But in the shelter, there's too many unknowns and there's too many animals and there's too high of a risk for this to really be a good idea. And at the same token, don't store your food in the refrigerator with all the other specimens and vaccines and medications and things like that. And you shouldn't be eating in the animal areas either. So don't bring them to your lunch area and don't go have your lunch in their area. All right, I know you all hate me now, but there you go. Public health veterinarian. We need to protect our visitors. We want to make sure that there's hand hygiene available and signage for people to use it. Ideally water and a soap in every area where there's animal handling, petting, greeting going on. And if not, at least the alcohol gel. Make sure animals with suspected zoonotic diseases are removed from public contact. And if people need to go into a non-adoption area, ideally isolate them or escort them through. Some areas should be locked. Whether it's for zoonotic issue or behavior issues. I know just having a sign on the door that says staff only isn't very helpful. On more than one time, we've escorted adopters out of those areas. In one case, I escorted the person out and we had several cages marked with, will bite signs because they were on bite quarantines or whatever. And as we were walking out, this woman was like, oh, this dog won't bite, by the way, and neither will this one, and neither will this one, but that one will. I'm like, well, you're sticking your hands in all these cages to see if they'll bite because the sign said they will. We have to protect people from themselves. I've also seen them petting animals that say, I might have a contagious disease, please leave me alone. And they're like, oh, poor puppy, and then they're petting them. So yeah, warning labels are not enough. We need to do a little bit more, I think. When we adopt, we need to encourage routine veterinary care and make sure that they take with them all the medical history that's available, including whether or not the animal was examined by a veterinarian and what was found. Any behavior history, including any potential concerns. We need to have full disclosure on all health and behavior, everything that we know about, and ideally some information on zoonotic diseases and risk and prevention. A lot of shelters are worried that they're going to scare people away from adopting with that kind of information. But this is very similar information to what veterinarians provide to their new clients. And risk communication, if done well, is going to be very informative and reduce their risk and should reduce their fear. We don't have to say shelter animal so it might be sick. It's all dogs, all cats have a risk of, it's a low risk, but you should be aware of it. And so it really is all about how we present it. Foster caregivers, we need to provide them training on disease risk prevention and recognition, just like we do our staff. And I know I'm out of time, so I'm wrapping up here very quickly. We're not required to by OSHA because they're volunteers, but we may carry some liability, right, if they get sick from animals that we own. And if we want them to continue helping us, we certainly want to give them all the tools that they need to do it successfully. So we need to also have plans in place. What do you do if someone's bitten? What do you do if an animal gets sick? What if their animal gets sick from an animal that they're fostering for you? Maybe they're fostering a ringworm cat and now their cat has ringworm. Who's going to take care of that? All of that needs to be decided up front and shared up front, right? Instead, schedule those retreatments and vaccine appointments so that they don't just fall through the cracks and disappear into the foster purgatory. Right. I'm not a fan of sending zoonotic cases into foster care. I will make exceptions with skilled homes and after a period of time has passed where the contagiousness has reduced to some extent. Other shelters are sending them out right away and have been very happy with their results. So there's a whole spectrum out there. You have to just kind of do your research and see what your comfort level is. All right, any questions? Happy to answer any questions. I know if you guys want to run off to see the expo or take a break, that's great. If you want to hang out and ask some questions, I'm here. Thank you so much for your time.
Thanks, Dr. O'Quinn. Folks, we are more than happy to leave the session running if you do have questions that you want to drop in. And Kelsey, wholeheartedly agree. There's nothing worse, I think, than lime dip smell other than getting
ringworm, right?
Yeah, if you guys
lime dip it has a residual effect, which is very nice. Go ahead.
Oh, that's a great question. So
that is a great question. What do you use to clean nail trimmers between trimming animal nails? So you would want to, if they're visibly dirty, they need to be cleaned and then kind of disinfected, but probably the best one stop would be Excel or Rescue, because it's a little more tolerant when there's organic matter or dirt present, and there's probably oils and things like that there. But you could every once in a while use soap and water and rinse it and then clean it with disinfectant and let it sit. Alcohol probably wouldn't be a bad choice either. Good question. Thank you guys so much for hanging in here today. I hope to see you at the mixology session.
All right, thank you again, everybody. Don't forget that these sessions are available for you and your coworkers to check out for the next 30 days through the Excel Events platform. So if you missed anything, if you had to step away for a minute, or if you think the information would be valuable to a teammate, please have them tune into the session. And as Dr. Quinn said, hopefully we'll see you at mixology. Have a great night, everybody.